Hip problems usually occur without trauma. Patients start to complain of hip pain with just everyday activities. The hip joint needs to be a very active joint in everyday movement. It needs to be a primary source of mobilization. It needs to be a primary source of power. Unfortunately, we don't really use it that way as much as we used to.
The osteoarthritic hip is the most common injury or diagnosis in hips in our generation. It is physically the breakdown of one bone against the other, forming the arthritic joint.
Osteoarthritis occurs by having too much stress on the joint surfaces and having that stress over a long period of time. But the stress is there because there is some imbalance in the way the patient is moving that's putting too much stress on the hip joint. Relieving some of the stiffness in the joint is usually a good way to get yourself back on track. Once you get mobility in the joint, the next step is to build strength in that joint.
We can restore strength, range of motion, and flexibility by 25% or more by increasing the strength around the joint, which will distract the bone-on-bone pressure. The reality is we're trying to prevent them from receiving that total hip replacement. Most of these patients have degenerative joint disease. They're at the point where they either get a hip replacement or they come and try to get some function back.
Gluteal muscles around the hip joint should be a primary source of power, and if they're able to be used now because you have found some mobility, you're definitely going to get some good short-term and long-term results.
They should be able to walk and perform their daily activities such as work, sports, and a variety of related activities in a more comfortable environment.
It's very difficult not to use your hip on a daily basis. Every time you stand up and walk, your hip needs to move. Your muscles need to work. Sometimes we don't realize that we're not using our hips and the muscles around it correctly. By all of a sudden getting the movement back and getting some strength back and moving the way you're supposed to move, it's a very, very good feeling to start to move the right way.